and sometimes I forget because I think of palliative care as really encompassing, but a lot of people do. They hear palliative and they think, oh no, it's the same as hospice or something.
Right.
Now it can include that, but really, as I was mentioning earlier, 20, 30 years ago, the idea of palliative oncology was just end of life care. It has come a very long way since then. So now what that really means, and maybe a better term, although it's not the term people normally use, is quality of life and health enhancement is really what you're talking about in modern times. Now, going back to just what I said earlier about, you've got your surgical oncologist and medical and radiation oncologist, their world is wrapped up in their treatments, which are so complex. They understand the need for this other stuff, but that's not their job. That's not what they do. It's people like me who do the quality of life and other care. What I usually tell people is there's really four steps in a cancer journey. The first step is you don't know you have cancer, and it's primary prevention. Most people are always making cancer cells, but they don't develop cancer or don't do it till later. The next step is what the book is talking about, which is diagnosis and initial treatment. And then the next step is actually recovery from treatment so that, you stay in remission or you get towards remission, et cetera. And then the next step is secondary prevention, which is let's not have it come back or get worse or, whatever. And the reason I divide it that way for people's minds is the amount of effort and energy you as a patient have, time-wise, energy-wise, et cetera, to put into working on those things is very different at each step. Primary prevention, preventing things, that can be 100%. If you are just starting with some surgery and chemo or radiation or whatever, you aren't going to have time and energy for very much. You're going to do, maybe, like I say, baby steps just to shore up everything. But in the recovery part, in what I would call palliative or quality of life recovery care, it's not about hospice or end of life normally. It's about let's get you recovered from, all of this treatment you just had. It's,
Yes.
there's no maybe there is. I can't think of a cancer therapy of any kind that is any fun and you come out the other side feeling healthier than you did when you started.
Totally.
There's this job you're doing of treating cancer, and now you want to recover. Well, one of the things, and I get to the mental emotional part in this book. The prior book, we talked a lot about it medically, but the more you do on the other end of recovery from surgery, radiation, chemo, et cetera, actually the more calm your cancer stem cells are and the less chance of recurrence later on. So when we're talking about palliative oncology, yeah, it's the whole spectrum. And while it might include more end of life things, that's 5% of what we're trying to do. Mostly what we're trying to do is make you as healthy as possible so that you have the lowest index of cancer wanting to come back or be aggressive, et cetera.
As I was reading about the secondary prevention piece, it wasn't just a second recurrence of breast cancer, but it was that no evidence of disease or no progression of disease, right? Like, how can we take this and, again, still feel empowered and, even with a terminal diagnosis, still move forward and, again, be empowered with the choices and the control that we have every single day that we wake up?
Mhm. So secondary prevention, the nice thing about the more modern way of looking at it is it's not just for people with no evidence of disease or in true remission. It's also for people who are either really, we had two other areas. One was uh, progressive but slow progressive disease, and the other was stable disease. And so you may have metastatic, stage 4 cancer, but you can do everything you can to keep it either very slow progressive or stable. So it's not in remission, but it's remission like.